Hey, my coding family, how's everybody doing? Happy Saturday, guys. Sorry about yesterday. Travis had a doctor's appointment in Vegas. His acne in his face has gotten cystic, so we've been treating it with antibiotics for over a year, and it's like barely covering it, and I hate to have him on antibiotics forever, so we're checking his liver, and if his liver's okay, then maybe we're going to switch him over to Accutane and see if that works, but there's a lot of hoops to get that covered and get it prescribed that you have to do, so we'll see. That's what's going on with me. I was doing tutoring all day. I just got finished with MK. I still got to do go-kart tutoring too, and I've got somebody scheduled for tomorrow. Who do I also have scheduled for tomorrow? And then we've got a workshop coming up this Sunday, not tomorrow Sunday, but the next Sunday. Tomorrow I've got Erica tutoring, and I need to get go-kart some tutoring in too. Monday I got Iris. Tuesday I got Janelle. Thursday I got Lucy. Sunday we've got our workshop. All of those I got to prep questions for. So it's going a little busy as usual around here. I was trying to prep some chemotherapy questions for you guys. I've got some integumentary radiation, E&M, digestive, muscular skeletal too, that was really cool. Maybe even a cardio involved in here too, but I've got a case is our first thing that we're going to do. Hey Sarah, good to see you. Hey go-kart, thank you so much for the message. Hey Fagan, good to see you. Hey Cassandra. Hey Mabel. Hey Joanna, good to see you. I haven't seen you in a while. Hey Mary. Hey Sarah, good to see you. Nicole, happy to see you. I'm so glad you're here. Hey Barbara. She is in practice test ABC, A and B. She got 84 and 74 with the process of elimination. That's awesome. Get those scores up to the 90th percentile before you take your exam, but that's awesome. The process of elimination just works great. I love it. I love playing around with it and seeing how things go. Let me get TikTok going. I always forget to go live on TikTok. Learn, make a goal. They always want me to do a goal. What's today? Today's Saturday, so no TGIF. Let's do Boo Ghost. Ghost, little ghosties. All right. And move lotion and stuff out of the way. There we go. There's TikTok up. And let me keep going. Barbara, that's awesome. Get my dad's chair moved up. Hey Mabel, good to see you. Joanna. JP, good to see you. Hey Monique. Happy Saturday. Bluey Mom, good to see you. Barbara, good to see you. Marcy. I did the AAPC practice exam. Definitely getting 90%, but sometimes 80. Awesome. And sometimes you don't even have to, you know, you guys don't even have to finish them. You know, you can just do one question and hit grade, and then go find your rationale and the correct answer. Love that you're able to do tutoring now. Thank you, Monique. I'm trying. Ada, good to see you, Monique. Yay, yay, yay. Flapjack, love your name. That's such a cute name. I know, but I get flustered a lot. I do too. Keep working on it. Hey, Mary, good to see you. Coleman, good to see you. I'm so glad you're here to catch a live. Yes, yes, yes. I have a hard time finding the procedures using the CPT index. Do you? Are you trying for a CPC exam that is not going to be multiple choice? Let me know, Flapjack, in chat. I'm going through AAPC study guide and I'm having problems with surgery and knowing what to code. What in particular, Sarah, are you having trouble with? Because they have practice exam questions in the middle of the chapter in the study guide. Are you having trouble with those? You're welcome, Coleman. Just trying to learn how to use the book. Ah, gotcha. Did you go through and actually just read the index? So, where's my camera? There's my camera. So, let me get this thing flipped around here so it's right. There, oh, is that it? Let's see. Yeah, that's it. Let me make it bigger. Sometimes I find things are easier once I've gone through them and looked at it. Oh, what are you doing, camera? Hold on. I gotta go unplug this thing and plug it back up. It's having a heart attack for some reason. All right, which one are you? You're the gray wire. Gray. There we go. I have been wearing this sucker out today. So let's see. Let me delete this. Yep, let's delete that and let me add another one. Add a video capture. There we go. So I know that you're working in the index and you just want to learn how to index and do CPT codes. Did you actually go through here and just take your time and read this beginning instructions on the index that are right before it, and take your time reading these, figuring out what the main terms mean and what is part of the main terms? What are the modifier terms? What are the code ranges? What are the conventions? How to do the lab and path? And then coming over here to the index and just starting out with looking at the blue headers, figuring out how they're related to the black words. What does it mean? Come on, camera. Focus. When you have a word that's indented here, but then you have words underneath it that are dented over and then another indentation, what does all this stacking mean? Why are some words here and then why are some words here? And all that information you get from that front page. And then also thinking about, like, throughout the book, if it's an excision in my integumentary area, that's anesthesia. Let me go to my integumentary. I have like this color code scheme that I go through and through my integumentary system. Just don't have it in front of me to remember, but I might have it. Hold on, let me go get it real quick. That's not helpful. Be there, it's not there. Where are you at? Not there, not there, not there, not there. Where are you? Where did I put you? Not there either. Okay, I can't remember what I did with it, but I have like excisions are blue, removals are green, repairs are orange. I have like this whole color code scheme somewhere. I just don't know where I set that piece of paper at right now. And I would go through this index and color code anything that's a repair, anything that's an excision, anything that's, you know, those differences, which ones are the removals, which ones are just biopsies. You could always color code. I find things stand out to me a lot better when I color code them. All my secondary procedures in here are color coded orange, but my initial and first procedures are color coded yellow, I believe. Here's my excisions are always color coded orange, but back here in the index too, if I was doing an excision, I would keep that same color code the same. So all excisions are going to be orange. So that's kind of helpful. I don't know. I like color coding. It makes things stand out for me, and then I learn how to use it better that way. Anything that's complicated or multiple, I have it again color coded as orange. Introductions are purple. Repairs are blue. So repair would be a blue one. And so if I was looking for an abdomen repair, it lights up for me. If I was looking for an abdominal excision, it lights up for me. So, I don't know. Then your body parts could have different color codes. Like abdomens are always, my belly hurts and it turns me green, you know, so maybe abdomen is always green. I don't know. And then if you're moving on from that particular body part, and then you're only doing a different body part, like, where's another one, that another blue header, it's going to be a different body part. Adrenal. So if we've moved on to adrenal glands or adrenal medulla, that's a different body part. Then if we're doing a biopsy or a scope or a partial removal, you know, those can all be different color codes. It's just going through here and really looking to see what you have, what's in here. How can you make it easier to find things than it all being just black, small, tiny print? How can you break it up into different things? What have we got going on right here? Anesthesia is a big section. So if you're looking for anesthesia, there's abdomen, and it goes back through the whole section again. And then if you're doing anesthesia due to burns or anesthesia due to the femur or legs, just figuring out how they have it all situated and what you can do to make it easier on you to find things is helpful. I don't know. I'd come up with something and try it out and see if that made it easier. But reading that first page and really taking your time and finding examples in the index of what they're talking about, because a lot of times when you're reading how they prepped the book, it's different and it doesn't match in my mind's eye when I read it versus when I go find it. It looks different than what I think they mean here. It's my reading comprehension always throws my brain into thinking something else when I read it. But when I go through here and actually find what are they talking about, what do they mean about the four primary classes of each main term entities, what the hell do they mean? They're classified as procedures, then they're classified as organs, then they're classified as conditions, and then they're classified as synonyms. How would I find that? What do those examples look like back here? And then I would put the page numbers down and color code. Okay, all procedures are this color. All organ is this color. Conditions are this color. But it's tedious and takes time. So then I would go figure out what are examples of their code ranges, what are more examples of their conventions. Because just reading it and comprehending and thinking of it in my mind's eye of what they're talking about always is different than when I go back here looking for it. It's the same thing that I do to the CPT book and how I came up with my color codes for the CPT book. In the very beginning of this book, they have the instructions on how to use the book and how they come up with the indentions and all that stuff that they have back here. So they have this whole beginning with the instructions on how to use the code book, and then they have tons of examples written in here of things that they're talking about, and it goes on and on and on. This formatting of the book, what does it mean? This is how I come up with my parent and child code analogy. Then it talks about your differences, like your add-on codes that don't get modifiers. That's how I knew that which codes could get a modifier and which codes you times. It's in this area, in the instructions on how to use this book. So if you haven't given these two things a good read before you try to index something, it's going to make it very difficult and obscure to you. So be sure to read those two things slowly and go find examples of what in the heck they're talking about in each little paragraph. Then you'll be better prepared for indexing, is my advice, if you have time. If you are just trying to prep for a certification exam, you don't need all that because it's all multiple choice. But if you're really trying to learn how to use these books, that's a good thing to do. All right, sorry, Sarah, if I missed your message. You can retype it and put it back out. Maybe that'll help. I don't know. I hope. Okay, where am I at? Okay, good. I got Flapjack's question done. And Sarah says I have been going through AAPC study guide and I'm having trouble with the problems in surgery, knowing what to code. Tell me more specifics if you haven't already. Joanne's at work watching this. That's awesome. I hope it helps. Jen, can you explain how to flag on the exam test? Yes, I sure can. And then get back to the flagged ones. Yep, sure can. Lab and Path is not hard if you practice looking at the top of every single page. Every single page has a header. So if you have an answer where answer A is here on this page, Answer B is on this page. Answer C is over here, and so is D. You've got two answers that are under chemistry, one of them under pathology, and one of them under drug assay. You can usually find these words matching in your exam question. So, and also looking for similarities, knowing that you've got two answers that are underneath the chemistry header, then you know it's probably one of these two, and then you can narrow down your answers. Paying attention to those headers at the top of the book is super helpful. I wish I had noticed that during my exam, and I wish the entire CPT book was done that way, because it would make a whole lot better instead of the entire system. Well, that's not helpful. What codes are these working on? These are just lobectomies, so this should be lungs, right, in the nervous system. You know, if they had each page highlighted which body part we were working on, that would help you eliminate a lot of answers. If I'm not repairing a lobe or removing something from a lung, then you know you're not on this page, so you can move on. But Lab and Path has that done up for us, which makes a huge difference. So that's just a quick, simple thing to help you guys answer. You know, the AAPC is getting super tricky. Their 2025 book this year, they took out the note pages that we used to have in their ICD-10 book. I don't know if they're going to do that in this CPT book this year, but their ICD-10 book for 2025 is missing not only your tabs, but we all knew that. They said they couldn't find a vendor to put them in there or whatever. But in their ICD-10 book, where we had all these pages of note available area, they got rid of those in their version of the ICD-10 book. And I'm trying to make notes for the CRC people, and we're missing these note pages in the back of the book that I used when I took my CPMA, and I like to have an area of drugs back there. Anyway, they're getting all sneaky and removing some of your writable available space. Since I've been preaching that you can have notes in your book, it's totally available and free, and you know, you can have as many notes as you want in your book. Now they're eliminating some note pages. Ooh. Did she answer that question yet? Sarah? Mabel? Yes, I'm going to answer Mabel's. The fill-in-the-blank question is what I'm working on. Index say, C condition, when it will say go somewhere else. Geez, the clock is ticking. Explain strategies, please. I have not been playing around with the indexing yet, because our exam has not changed to fill in the blank yet. I'm assuming this is going to matter as far as our main terms are working. So if it says C condition, you need to learn the formatting of your main terms, where the procedures are listed, where the organs are listed, and where the condition is listed. It's all going to be in that particular order. You need to find examples of what they're talking about, and I'm assuming they're talking about body part breast, right? And they said the first thing that was going to be listed was the procedures. So breast, they have ablation, right? And then they're going to talk about which organ. So under the breast, do we have different organs? That may not be a good one, because it's just one particular area. They may have lymph nodes versus breast tissue, but other than that, that might not have too many organs. But the condition, they're talking about, condition. What are we talking about? Example, abscess. Okay, so yeah, the condition, they're talking about what type of thing are we removing? An abscess, a lesion. So we've got abscess as one of the main headers. We've got a cyst listed down here. Then we have an implant. What condition are we doing? So learning, and see highlighting anything that might be a condition as one color code, the organs is one color code, the actual procedures like a microplexy or mastectomy, those procedures could be highlighted as a different color code. That would be helpful. But really getting into this index and figuring out what the heck they're talking about and looking at the examples would be super helpful for that go-kart. But I haven't created anything in particular for you guys for fill in the blank yet. We're not going to worry about that till January. Okay, Sarah says, I'm having issues determining in those chapter surgeries. I think I am getting lost in all the words. Do you have a video on E&M prep with more than just the guidelines? Should. Let's go. Let me go here. Go here. And then we'll do the AAPC and I'll show you how to flag the questions. So where is my YouTube? Go to my channel. All right. And let me move this out of the way. Camera out of the way. And let me go to window capture. Right there. And turn that on. There we go. So that's YouTube, right? If we go to the playlist, it's, let me see if I can't zoom in for you guys. So if you're at my YouTube channel, this is what the main homepage shows you. Upcoming lives, whatever. Up at the top, you've got all these little options. If you click playlist, right there, I've got all these little headers done. So let's look for CPT book prep, because you're looking for E&M, right? So CPT book prep is right there at the bottom, right there. Instead of looking at or clicking on play all, click down there at the second one where it says view full playlist. Click that. When you do that, over here you get all the videos. So they're labeled, like this is just musculoskeletal, this is anesthesia, there's respiratory, hip picks, sequencing, lab and path, goes on and on. But they're all header related, and there should be something in here for E&M somewhere. Female, male and path, anything like that. Should be something with the E&M somewhere. I'll also be going live as soon as I get this 2025 CPT book, and we will be doing, of course, all the notes all over again. If they're needed, there's one for E&M right there. But hopefully you can attend when I'm doing my lives or watch the replays here. I'll make sure this year not to just record the guidelines, but move on into the E&M codes and make sure some of those are available. But be sure to go to that playlist. That's super helpful. Okay, let's go to AAPC. I might have to log out. Exams. Let's see. let's start an exam real quick. Let's see, something that we can do. We got 50 questions in this one. Proceed. So what I'm going to show you in this one is, turn off the video, how to navigate the questions. She wanted to know how to flag them and go back to them. Okay, begin our exam. So the first thing you got to do is go up here to the very top. There's 3 little lines right there. That's kind of handy to know where that is, because that'll bring up this sidebar that'll show you all your questions and then how many questions you have in each section. Like anatomy, this one has 3 questions. For medical terminology, it has 3 questions. For coding guidelines, it only has 1. Payment methodologies, it has 6. Compliance, it has 2. I'm in a COC, practice exam question area. So that's kind of handy. So let's say if I wanted to do all the diagnosis code ones, you can click on that. And then I can get rid of this by moving that over and get rid of it. By hitting these little arrows is where you find them. Then this is my first question. Am I an S or am I an M diagnosis code? That's the first thing. Was this an injury, or was this something? So it was probably an injury. Don't know what the answer is. It probably is A. It could be B, but we can click it and click flag it up at the very, very top where it's telling you you are on page 1 of 7. You're under diagnoses. At the top you can hit flag, and then we can hit submit and go to the next question. We can click on this one. We've got 2 that start out with the same answer, C or D. Then the only difference is whether we're a 132 or a 142. I see the 142 is in one of my answers, B, so I would pick D and move on to my next question. I'm not going to flag that one. I'm just going to move on. This one, am I an H10 or am I H57? Probably a 10 because there's 3 of them that way. Would I be non-specific as far as a 0.9, or would I be 6 digits out, 4 digits out, or 5 digits out? I like 6 digits. I don't know. Are we bilateral? It's only left eye. Left eye ends in 2, doesn't it? We have a little trick on this. Right eye is 1, left eye is 2, 3 is bilateral. I don't know. I like A. Whatever. I can flag that and go back to it. But hit submit page. And then let's see. What's the information page do? What did that do? Oh, it's just telling you the instructions on how to. It's multiple choice, so it's kind of funny. All right. If I go down to and you click on that 3 digits again, where you've got that full list of all of the questions, the 3 little lines in the top left corner, now you can see how many questions I flagged and how many questions I don't have flagged. And then if you want to go back to that flag question, you just click on the flag, and then it brought me back to that one. If you've done these questions and you've got to go, the kids are whatever, and you want to finish this exam, but you want to see how you did on it, just click on the very last question, and that's how you find your submit exam. You can hit submit. Yep, go hit submit. Yep. And then have it grade what you did so far, and then hit view my results, and then show answers and show results. Show answers, show results. Show answers, show results. And then that way you can see all your answers and rationale. This one was the smallest of the two numbers. Instead of the 21, it was the 1. I had it down between A and B. And then this one was, oh, it was the 132, not the one that was the 142. Close. And then this one was the 4 digits instead of the 5 digits. It wanted the non-specific one. Great. It's got them all wrong, but that's how you navigate and play around with your flagged questions. You just got to find those 3 little dot area in your exam practice question area. Hopefully that, did you see that? Did that make sense? Or did I move too fast? Joanne says you could explain that. If Mabel, that was Mabel. Did that help, Mabel? Yeah, I do not like tabbing the sides of the book because you are running from code to code, and if you are running from code to code, you need to see the tops of these pages with all the CPT code numbers on them, and you just cannot have none of this in your way. If I need to tab something, I tab it at the top. The only things that I have tabbed are things for you guys, like, where was I at in radiology today? I was in radiology, and there was pages that I liked that have definitions. Like if you're in the 2024 CPT book, page 568, I tab that page because it has your guidelines and the definitions for your clinical treatment planning, for your radiation therapy, and it's really cool to have that page tabbed. I like the things that have the definitions of things listed on them. Another page that I tabbed was page 556. This is the definitions of your ultrasounds, the difference between A mode, M mode, B scan, and real scan. That kind of stuff is really helpful. There's something else I tabbed up here. Yep, page 571. Again, your radiation treatment with the differences between simple, intermediate, complex. Your IMRT energy with your differences between simple and complex is also tabbed. And then that graft page that they have on page 572, I tabbed it too because it's your radiation management and treatment table, and learning how to use this and knowing how to look it up is something that could be helpful in more of your advanced certifications, not for CPC, but if you're going for anything that is CPMA or your surgical or radiation or radiology certification, these are pages that you definitely need to know how to use their little tables. I like the next page, 574 too, because it gives you the definitions of your proton beam treatment, whether you're simple, intermediate, or complex. Those terms are helpful to know before you try to pick the correct answer on proton beam treatment. Yeah. You got your nuclear medicine coming up too. It's all very cool. Somebody had the question about the surgery section. Knowing that she's having problems in the surgery section. So surgery section is everything from integumentary all the way back, basically. So That's anesthesia. Where's my surgery page? Noticing patterns in your surgery section is helpful. Knowing that the very first part of your surgery section is needle aspirations. You're going into the body with the smallest thing you can. It's not a camera. It's not a scope, you know. It's not a scalpel. You're not doing anything but sticking a little needle in somebody. And that's the first part of your surgery section. Then you move on to the introduction or removal of things. So are we putting something in the body or are we removing something out of the body? And then you move on to like incisions. Are we cutting into the body, draining something? And then we move on to biopsies and stuff. Are we biopsying it? Are we shaving the biopsy? Are we doing a cone biopsy? How are we doing the biopsy? Then we'll move on to like removals and then shavings and then excisions. It's just knowing that the book is in different sections, and then the first things that you do are the least invasive. They're the smallest things that you can do. We only stuck a tiny little needle in here in surgery. And then if you're in the back of the surgery section, we're doing these flap grafts that are, you know, whether we were adjacent or a different area where we're moving body parts from other people and then we're putting them in somebody, we're getting deep into certain procedures back here. So knowing you're simple and then knowing you're complicated as the last pages in surgery, that's kind of helpful. And then knowing what body part is affected with each CPT group is helpful if you can do that. When you're grouping these codes together for your mom and pops, it's also nice to have what body part you're dealing with or what type of item are you fixing. Like, am I doing a foreign body, or am I doing a cyst, or am I doing an abscess, or am I doing a hematoma? So that's what I've done here. These two are only dealing with an abscess. These two are only dealing with a cyst. These two are dealing with foreign body removals. This one's dealing with a hematoma. So if I'm doing an incision and drainage, just having them grouped together as to what I'm removing and then putting the word down as to what it is helps me keep things straight. Of course, you guys can't use whiteout, so don't look at my notes. You can't do that, but I did. Just because I don't like those stupid little, when I'm taking pictures of my notes, the little blue and green CPT changes and CPT assistant things get in my way of focusing in on clear pictures because they're bubbles and they're color coded. If I white those out, we can't even use them on the certification exams anyway, then my pictures are clearer because it's not hyper-focused on this area. It's more focused on this area. Anyway, so don't pay attention to my whiteout. You know, you guys can't use it. But really getting into the book and grouping every single and touching every single CPT code and every single little guideline, finding out what the heck they're talking about in that section, and then going into that section and figuring out what that means and how you can highlight it so that it's grouped with a header. Grouped with a header, it's super helpful. We've got epidermals, 2 sets of codes that are epidermal, 2 sets of codes that are epidural, but what's my difference, right? They're body parts. Orange is for my trunk, arms, and legs. Yellow is for my face, scalp, and eyelids, right? So color coding is super helpful. It's the only difference is the body parts, and highlighting that stuff is helpful. So really, it's just a lot of work, but it is super helpful to go through here and do those differences and writing in the scenarios. Tonight I've got practice exam questions that are going to be super cool. Ooh, my camera is just not going to be happy today. The first one is one that I did with MK today. It was really cool. It's a case that we have, and it has 4 questions. And the first thing that I do when I handle these is don't read the question. I'm only going to the answers. And what we're going to do is we're going to go to those different answers and we're going to look up our differences, right? 15200 is what? What type of header am I under? Where am I at in my book? So 15200 is full thickness, right? So is our 20, and so is our 40. These 3 are all under full thickness. The only difference is body parts, right? So 00 is under trunk, 20 is scalp, legs, and arms. We've got 40 is forehead, cheeks. So they might give us something that, you know, it's kind of confusing when you have scalp in one and you've got forehead and cheeks and chin and mouth in another one. So that's a really sticky little area. They also have hands and feet. But our only differences is just a body part. And then 5040, where is that one? 5040 is not a culture. That's a harvest. So instead of a thickness graft, it's a harvest. That's where we grab a graft. So the first thing we're going to do is go look through our example and see what body part we're dealing with, right? Make sure you guys can still hear me and see me. And Mabel, let me know if that helped you with your with the flagging questions. No note on pages. I'm having issues determining. Yep, I answered that one. I found one, but it's just the guidelines. That's helpful. Okay. All right. Don't forget to tell me in chat when you guys are taking your exam, because it's getting close to the end of the year and I want to keep track of when everybody's taking their exams. There's our last answer question, but we're doing left ankle. That's all we need to answer our first question. That's it. It's the only thing. What answer do you guys think is the correct answer? Just put it in chat. You guys in TikTok too. Where do you think, which code are we going to use for that? Can I ask, what's the starting pay? My sister is single mom. It depends on your region. AAPC has a survey they do every year about income, and we all fill it out and send it back, and then they present the results. I just finished my career in medicine. I worked 30 years in medicine, clinical, saw patients, and then I went into medical auditing. And when I finished in May of this year, 2024, I was making 6 figures. So it depends on who you are and what you do with your career. But AAPC has that already done. I live in Arizona, but I worked out of California, which has a higher pay scale than Arizona does. So if I had the same job in Arizona, I know the pay wouldn't be 6 figures. So, you know, you got to get kind of creative sometimes, but I worked remote from home since 2013, so that also makes a difference. What do you guys on TikTok think the answer is? There is a few of you guys. There. Thank you for the tapping and clapping, Miss Beverly. You are awesome. Can you give us answers on wound care? Yeah. You got a new job starting on Monday? Great, Key. That's awesome. Renee is doing hers on 10/23. Cassandra is doing 10/26. Okay, perfect. The body part is ankle. So if you're in your 15200 to 20 to 40, I don't know if my camera is working again. So we've got 5200 is trunk, so we know that one's not it. We've got scalp, arms, and legs on the 20, and 40 is forehead, cheeks, chin, mouth, neck, axillary, genitalia, hands, and feet. And this one is just coding a harvest of a graft. But we know we did, well, I guess, let's see, what did we do today? Procedure. We did do a full thickness graft. Says it right. Where I've got the camera covering it up. Right there. There we go. So we did do a full thickness graft, so we know we have to be up there in A, B, or C. Where do you put ankle? Are we arms or legs, or are we in hands and feet, is really what they're asking. Do you know where you put an ankle? Is an ankle considered a leg or a foot? I still don't see a correct answer in chat anywhere. Hey V, good to see you on TikTok. There you go, Fagan. Marlene, yep. It is considered part of the leg, right? So we're going to be part B. So now that we have established that an ankle is part of the leg, and there may be more different excisions throughout this surgery section where body parts are separated and ankle is never mentioned, go find everything that mentions scalp, arms, and legs, and add your body part equals ankle. And all your notes that say nothing about ankle so that you can get ankle written down. Look, this one's trunk, arms, and legs. That means we're talking about ankle. So finding it everywhere your legs are listed and writing it, unless you can remember it from here on out. There you go on that. Our second code, let's look at our differences here. Our 110s are under what section? 110s, those are under debriefment. Our 113s are under shaving or biopsies. And 114s are under excisions. So I'm not really technically looking at the individual CPT codes. What I'm looking at in 110, so instead of looking at individual CPT code descriptors, if you go to the 110s, their blue header before you start coding the 110s is debriefment. That's what I'm putting in my head. Then the 113s, if I go there, 113s, their blue header is shavings. And then if I go to the 114s, its header is excision. Doing the exam this way instead of hyper-focusing on full thickness graft free, including direct closure, trunk, whatever, 20 centimeters, you're driving yourself nuts doing all that when you could only be looking at excision, debriefment, or shaving. That's it. That's all I got in my head. And I can answer this question with only that information. I don't need to know what the CPT code descriptor says. So we're going to go look at our question and see, did we excise, did we shave, or did we debride? So we're going to go look down here at our procedure, right? That's where it starts. Going to read the procedure part and we'll be looking for anything about what we did in our procedure. Can you guys see what we did? What did we do? Just put it into chat. Fagan sees shaving? No. Excision, excision, excision. See? And we only had one answer that was an excision, right? So you know your answer has to be B with this one. We know it's A with the first one. Do we need a modifier? 75% of the time when AAPC asks you a question, is it this, this, or none of the above? You guys know most of the time the answer is no. But our 58 modifier is staged, 78 is unplanned, 77 is a repeat. This patient has a chronic ulcer. We're trying to rule out malignancy. Our indications are she's 77, chronic ulcer, several months, several times. It's almost healed, never quite. They've done a punch biopsy. They said it was suspicious. Decided to do a full thickness graft and remove the whole thing. What do you guys think on the modifier part? Any modifiers? Good job, V. Good job, Sarah. Let's pick no modifier. Our diagnosis codes. So if we go to our diagnosis code area question, which is next, what I see and what I would do during the exam is go to L89 or L97. That's it, because I've got two answers that are, Lorraine, thank you so much for being a YouTube subscriber. I hope
Lorraine Watkins has become a member.
Access to all those book prep videos and the old workshops help you out tremendously. So we're just going to go to L89 and L97. That is going to help me eliminate two answers right away by just looking at the headers. So L89 is what? L89 is a pressure ulcer. L97 is a non-pressure ulcer. Is she a pressure ulcer or is she a non-pressure ulcer? If you look at L89, it includes notes, says bed sores, decubitus ulcers, plaster ulcers, pressure area, pressure sores. If you look at L98, it includes notes, L97, and then our L89. Ooh, I'm so dyslexic. L97, our includes notes, includes our chronic ulcers, non-healing, non-infected, chronic, tropical, or ulcers of the lower limb, NOS, non-specific. So yes, she is definitely a B or C. And then our only differences between the B and C is the 6 digits. So our 6-digit difference, L97, 3, 32, 1 and 2.
Kamara Morlai has become a member.
Is whether we are subcutaneous or whether we were down to the muscle. If it's B, we're under the muscle. If it's 1, we're subcutaneous level. What does our chart say? It says we're superficial to the fascia. So are we a B or are we a C? Sorry. What do you guys think? I gotta reboot my computer. It is not happy with me. So if I disappear, you know it's because my computer needs to be rebooted and I haven't done it today. B means under the muscle. Where is excised? Just superficial to fascia. And it's, you know, not really clear, which is interesting. That the 1 is limited to breakdown of the skin, and where the 3 is with necrosis of the muscle. And I don't see anything. She's just got this chronic ulcer, but they're not saying anything about it being necrotic down to the muscle, and they just say the word superficial. So definitely probably C, but they're trying to push you by mentioning the fascia, which is technically in the 2000 section, but we're not under the muscle, so yeah, not B. But that's the only things. This case is really long, but the only things that I needed to look up for this exam questions is knowing the tricky little things. Is an ankle part of the foot or is it part of a leg? And that's not really clear, and it's not really described in the CPT book, right? You're just supposed to magically know this. And then the only other thing is, are we doing a debridement? Are we doing a biopsy? Are we doing an excision? Do we need any modifiers? Most of the time the answer is no. And then, do you know the difference between a subcutaneous ulcer or one that is necrotic down to the muscle? The rest of this question we didn't even look up. So here's all the answers. We did get our B and our D and our C. And when you find something that mentions there's a guideline that says that the ankle is to be reported with the arm and the leg, try to find that guideline. Try to mark it marked. Also mark any codes that are listed without an ankle procedure, that are only listed with foot or leg. Be sure you mark up the legs. Let them know that they include the ankle. Don't just sit on all this work and then not mark it in your books. That way you've got it for the next time you see these questions during your exam. Good job, good job. All right, let's move on. Rapid fire questions. What do you guys think the answer is for this one? Kamara, yay. Lorraine. Was there another one earlier? Sarah and somebody else. MD something. And Ashley. All became 6 people, became YouTube members today. Thank you so much. That is awesome. What do you guys think is the answer for this one? Is it getting too late? Have you guys gone to sleep yet? Let's see. How many do we still have on? Just 20. And then 3 people on TikTok. I know, started too late. It's only 6 o'clock here in Arizona, 6 p.m., so it's not late here at all. Thank you for the 18 likes on YouTube. And we got 2 new members. And I need to give away some YouTube memberships. So out of you 20, if you are not already a member, you've got pretty good odds at winning. Let's see. Let me throw YouTube some money here. it will pick 5 random winners. Dana, Katie, Tasha again. Good to see you. Kristen, Jackie, Saber. Yay. I hope those YouTube memberships help you guys out a whole bunch. What do you guys think the answer is for this one? I got 1C. Where's my modifiers at? Yes, we got C. Do we need a modifier with this one? Would we do 52 or 26? Our 26 modifier is our professional component. Do we need it? And our 52 modifier is reduced services. If we don't need either one of those modifiers, then it's just a difference between, are we in what, cardiovascular, or are we in the radiology section? Where would we do this one? Keep knocking over things. Thank y'all for the 2,000 taps on TikTok. This one does need our 26 modifier. We are going to be B with this one. What about this one? We've got, again, the 26 modifier and the 52. Same thing, just a little different. Yeah, Ada. Yes, Sarah, this is the one that's going to be A. Perfect. What about this one, when it's written this way? Good job, Mabel. Yep. When they're going to use an outside physician to read the results, then the facility doing the CPT code, they're actually doing that test, they have to bill or reduce services because it's not being interpreted in-house. We're having to send it out. Perfect. Yep. Good. Now you got it. This one's 2 pages. First thing I would figure out, am I a 56 or a 58? Look to see if I'm in those areas. I'd be suspicious about adding radiology to these codes. If I'm not in the 56 and 58 area, then I'd move down to the 61 and 71. But I try to stay, at least do 2 codes at a time because I can't do all 4. My neighbor's yapper. Here's the second page. What'd she say? Why would it be reduced services instead of TC? Because it's inherent in the code descriptor that if you're billing that code, interpretation is included with that procedure code. And we would not need to do TC because we are not an outside service facility. So we're in-house, the patient's in-house. I didn't have to send my patient from my facility to another radiology center somewhere else across town because it's the only facility that maybe does open MRI, and our MRI machine is closed, and we can't get the patient into our closed MRI system because of their anxiety or body size. If I'm the one who was referred and I'm supposed to be doing that procedure, but I need to borrow another facility to use their machine, that's where you get the TC. Does that help, Sarah? And I do not see a correct answer on this question at all. So let me go to my CPT codes and look these up and see where y'all are going wrong. So 365. Ooh, I got y'all some tricky ones tonight. My goodness. 36556. What's going on with this one? It's a child code. I can't do nothing with it. I gotta go look at its mama. 36556. Mama code is 36555. This is a non-tunneled central venous catheter. Did we do tunneled or did we do non-tunneled? We did tunneling. Why are you guys picking a code that is under non-tunneling? Did you go look at its mama? You gotta go look at its mama. 36555 equals non-tunnel. And it says right here, they tunneled. So try again. So if it's not 56, what's our 58? 58 is a child code. You can't do nothing with it. We got to go to its mama, which is 57. Did we enter, give this patient a central catheter? Was our catheter placed centrally? If it was tunneled, it is not central at all. So 58 is not it either. B, move on. Let's go to C, 61. 61 is a child code. You can't look at it either. You got to go look at its mama, which is 36560. Is that one tunneled? It is tunneled. Okay, we got something to match. Our 71 is a child code. We have to look at its parent code, which is 36570. Oops. Why are you not going right here? I don't know why. 36,570. I hate Word documents sometimes. And then it's peripherally inserted. No, we didn't centrally it. We didn't peripheral it. We tunneled it into place. And the only code that is tunneled, central, peripheral, and then this one's tunneled and then that one's non-tunneled. And also, if you have my notes in the cardiovascular area, you also have an AKA next to your 61 and 60 that let you know this is called infuse-a-port or port-a-cath. We put a bunch of little AKAs down beside this code that if you ever see the words infuse-a-port or port-a-cath, doesn't matter, you always know you're supposed to be at the 60 or 61, always. You don't have to end up looking for the tunneled or central or peripheral or whatever else. But yes, yes, yes. This one is C. All right. Which of the following groups of people are eligible for this type of insurance? Aw. I'm unable to go live. Why not? I forgot to do the mappy thing. Yeah. On TikTok, I got booted because I forgot to do the puzzle piece. After an hour, you got to do the puzzle piece, and I wasn't paying attention. Oh well, I got booted. Yes. Technical issues. I reported it to TikTok. Tell them to stop that. They shouldn't make us, if we're live, and, you know, we've been live for a long time, they really shouldn't make us do that kind of stuff because we're busy. All right. You guys know the answer to this one? I know you guys can get this one right. Yes, D. Perfect. Workers' comp laws serve what purpose? Yes, D again. Perfect. What about this one? Social Security insurance. Benefits who? Yep, long term. Good job, Sarah. Medical condition not covered by insurance is called what? An inclusion, option, exception, or exclusion? DC. It's D. Your fingers were trying to tell you the answer, go-kart. Exclusion, not an exception. Exclusion. Which of these situations does not require informed consent? What do you guys think? Informed consent. B is correct. Prescription. Changing the date of service on the insurance claim is legally considered what? Some of you guys that are taking your exam, who was that? Renee, Cassandra, the 23rd and 26th. I ran across this little piece of paper. I used to show this off a bunch, and then I don't know why I stopped, but this was cool back in the day. Be sure you know your definitions of ERDS, what a Warthan's tumor is, phalanges, what the heck are those, the difference between ALS and BLS, adverse reactions. Your fifth digit is going to be a number 5. Pick the answer with that answer. Tissue transfers with punch biopsies. If you know that your 114s are benign and your 116s are cancer, that's kind of helpful. Be sure you know how to code this kind of prosthetic put in. I don't know if I can say that word out loud. Male genitalia fake product put in. VBAC, what does that mean? It means your code is going to have a 9-4 in it in the second and third position. Be sure you know what that is. Know what the diagnosis code J11 is. What does the second P in HIPAA stand for? What does the first C in NCCI stand for? That is helpful to know on the exam. And then be sure to know about the modifiers 50, 51, 76, 77, 73, and 74. They love using those on the exam. Anyway, I haven't shown that off in a long time, so that's kind of handy. All right, sorry. 11:18, Ada? Okay. Got you down. All right, this one. Everybody got fraud? Which one of the following is not usually part of a laboratory report? Good job. C, yes. CPT stands for? Is it a procedure, a physician, or procedural? Terminology or a technician? Is it certified, current, coding? Sometimes they hit you with some of the strangest ones. That one's A. E&M. If a provider states in their documentation that medication was reviewed, what are we? Straightforward, high, moderate, or low? B, moderate, yes. Okay. You know you have 3 elements of MDM. First element is problem. Your second element is data. Your other element is risk. Which category does this item go under? Oop. Mom giving medical history. What element does that go under? Good try, Sarah. Keep going. It does go under data. What about results from another MD? What if it's the reason why they come in today? Like, we had an x-ray and this doctor said I needed to come see you because of this x-ray. Here's the results. Yeah, no matter what, it's still data. Yep. What if their diagnosis today diagnosis is due to being homeless? What if their diagnosis is due to them being homeless? Does that go under problem list, data, or risk? Yep. What if their diagnosis is due to a domestic violence situation? What does that go under? Yep, risk. What if their diagnosis needs to be in OBS situation. What area of MDM does that go under? Their diagnosis needs OBS. Is it a problem, data, or risk? Yeah. If your patient has I'm utilizing this chart on page 8 or 9 or 10, depending on which manual you have. And I'm just looking through these columns. This chart is set up in 3 different columns. They don't do a very good job of explaining that, but this column right here and everything underneath it is all problem list stuff. This column right here is all data. Anything that's listed down here in this area is all data issues. And everything over here is your risk, all the way down that whole entire page. So if you're looking under an acute illness that requires hospital inpatient or observation, you're under the problem list. Yeah, that is problem. Okay, what if your diagnosis requires IV monitoring? What are we under for that one? Do you see IV or monitoring on this page underneath problem list? Do you see the word IV? What book am I in? 24. IV treatment would go under risk, because if you're giving them something in the IV directly into a vein, you know, and you got to have them monitored because of whatever you put them on, whether it's morphine or it's a radiation treatment, whatever, I don't know, that's still an increased risk. Yeah. What part of MDM is your nurse setting up what do they call that? Oh, my brain is going blank. Coordination of care. With the MD. That's going to go under problems, data, or risk. I got you, Fagan. Good job, Sarah. Yep, that's data. So if you look under data, under category 3, you've got discussion of management. Management of care is all under data. Fagan, check out the very last page of your CPT book. In fact, look at the back cover back here. Common abbreviations. Look for it here. Be careful when you're looking through these because some of them have multiples like IV or IVC. It could be intravenous graphy, or it could mean inferior vena cava. So there's a comma in between. So some of these have multiple meanings. So look for the commas too, but I'm spilling soda. ERSD is down there. Knowing, even if you don't know what things mean, being able to know that your book has everything in it that you might need for the exam, you just need to know where to find stuff, is super helpful. One of the ones that is not on here that I did write in is JVD for jugular vein distension. ESRD is under end-stage renal disease. But your back cover of your CPT book, everybody's got the same one no matter what. That is back here. Can I please repeat what you're looking for, Marlene? Repeat which one, dear? The MDM or the ESRD thing? You got it, Fagan. Sorry, Marlene, I was moving too fast, so I don't know which one you want me to repeat. Oh, the JVD? Oh, yeah, I forgot what I said. J and V is in Victor, D is in dog. J is in Jennifer, V is in Victor or victory, and then D is in dog. JVD means jugular vein distension. I wrote that one in. I probably have more that I wrote in prior years. Yeah, here's a 2022 one that I wrote quite a few things in. I wrote AFL for fractional ablation laser. I thought that was cool. You know, the full thickness skin graft. I wrote the definition of it too, FTSG, because it's not on there. I did the icy thing too for the eyes. It's written out inside the CPT code descriptor for that particular code, but just in case you didn't know what ICCE is, that's the eyes intracap extraction. There's my jugular vein distension. See if I can't get this to where. Yeah, jugular vein distension. Also did IVA, because I don't think that's in there. Intravenous access. I also have ICR, intensive cardiac rehab. IOL, intraocular lens. EOE, esophageal stricture. I got even more. I got ARDS way down here at the bottom. I can't get my camera close enough because the book's too long. But ARDS, acute respiratory disease syndrome. That used to be on the exam. But like I said, this is a 2022 book. They did more acronyms back then, but VAR, various routes of administration. But if you get a copy of my notes, they're in there somewhere. And you can replay this video and rewind it and be able to catch all those too. So, yep. NCCI, what is NCCI? Oh my. All right. In your AAPC study guide, any version, doesn't matter what year you got, if you go to the beginning of this book, NCCI, I think that's like, where did we have that? Right there, right there, right there, right there. We've got National Correct Coding Initiative. More government bureaucracy for some reason. It is the CMS implemented a National Correct Coding Initiative, NCCI, to promote accurate coding. It lets you know what things are bundled already inside certain things, and they usually give you this table thing to look at when you are doing NCCI edits. And the main thing you're only looking for is something that they call a modifier, even though it's not 2 digits and it's not listed anywhere in the CPT book and it's crazy. I don't know why they freaking call it a modifier, but this is not really a modifier. It's an indicator to let you know that you can use a modifier. So that description is crazy. I would put indicator right there. Your indicator numbers are 0, 1, or 9. What you're looking for is the 1 that it's allowed. You can use an additional modifier attached to that code and it will go through and get paid. So anything that has 0 means nope, you can't use anything with it. So anytime you see something like this, the only one with the 1 is these 2 codes. So that's how you read an NCCI chart, is you just look for the ones that have the 1 beside it. And then they have more descriptions of what it means right here with fancy terminology and stuff. But just for the exam, you're just looking for the 1s. It's an indicator is what I consider it. Even though they call it a correct coding modifier, the indicator will be either an O, a 1, or a 9. But then they label it a correct coding modifier. The indicator will be a 0, 1, or 9. Anyway, it's in your study guide. For this one, it's under chapter Surgery Guidelines and HIPICS Category 2 and Modifiers chapter. What is this chapter? What number? Chapter 4. According to my study guide, but this one's pretty old. Is that helpful? Oh, what page was that on? Chapter 4. You know, it'd be helpful if it was under the business of medicine. I think it should be in the front of the book, but, you know. Chapter 4. Page 73, but I'm in a 2019 version. So, page 73. You're welcome. My chapter 4 starts on 45. Oh my gosh. That's crazy. My chapter 4 starts on page like 70. It's crazy. All right. Let's quit playing around and get you back to real questions again. I probably confused you enough. What about this one? What category are we in for radiological images? Category 2, independent interpretation. Is that for radiology? Look at page, oh, thank you. Where'd y'all get to jigging from? Safeway. Ooh, son just brought me big old bird. Woo, so nice. All right, so if we're on page 8 and 9, right here, we've got category 1 listed right here that has test, documentation, and independent historian. Category 2 is for independent reports and tests by other physicians. And then category 3 is discussion or management of tests and interpretations. Which category are radiological images reviewed today and seen by the patient? Are we in category 1, category 2, or category 3? Knowing how to utilize that page on 9 or 10, depending on which book you got, is super helpful. Because they hit you with these obscure, weird questions. I still don't see a correct answer on this one, I don't think. There you go, Fagan. A. A is correct. If you were getting the radiology report read by an independent physician outside, you know, you might be category 2. If you called up the doctor and y'all two discussed the result together, you'd be category 3. But just having an x-ray with a patient today, you might have ordered a CBC and a chest x-ray if they came in for sweats and loss of weight. That's all category 1. If you and your patient, you as the physician, and you and your patient are both taking care of this x-ray and you're reporting the results, it's just category A. Category 1. All right, which of the following conditions can cause a chronic cough? Oh, I got 20 of you guys on and 28 likes. Thank you so much, guys. Got 7 new members on the YouTube membership. That is great. You know their favorite answer, none of the above, all of the above. Yep. All right, are we, and I'm just talking about the last digit, a 2, a 3, a 4, or a 5? If we're going to bill a 5, they're circling the drain and about to die, right? We got to send them somewhere. If they're a 2, we didn't do nothing for them and tell them to go home and rest, right? Sometimes it's a 3 if we told them over-the-counter meds. Sometimes it's a 4 if we wrote them a prescription. So, what do you guys think about this patient? If you don't have MDM and you don't have time, and you need to pick particular MDM, what do you guys think the answer is? Rhonda, good job, good job, good job. Perfect. What about this patient? Are we minimal, low, moderate, or high? The last one was low for a UTI. This one has a UTI and diabetes. We've got a chronic condition and an acute condition. If the last one was low, what would that make this patient who has a chronic? There you go. Perfect. All right. I've been on for 2 hours. I'll stop there before we move on to the next set of questions. I've got more. We'll do those coming up on Monday. We'll have 2 more hours of free questions. We've got medicine, nervous, like the spinal area, more tummy, some more medical terminology ones, and then I've got those radiation questions that I was trying to prep, and I'll gather up some more on how to do radiation and chemotherapy exam questions for Monday. So we'll do those come then. So I hope to see you back on Monday. Between now and then, I've got to tutor 3 people, go-kart, somebody tomorrow, and somebody on Monday. We got tutoring I got to prep questions for, and we've got our workshop on Sunday too. So if you haven't scheduled yet, let's see, where is that going to be at? Let me go over here and go to here. Go here and go to there. Yeah, let me get rid of the word, and then let me turn on that. Is that gonna work? Probably not, huh? Modifier, nope, don't want that. I want this one. Nope, not gonna work. Okay. Let's see, window capture. Yep, there we go. So this is the website, Medical Coding by Jen. It's right there. All you gotta do is click book now, and you'll throw you in on Sunday's workshop. Not tomorrow Sunday, but the next Sunday. We're gonna do 75 questions that no one has seen before, and it's supposed to mimic the certification exam. So if you book this, you're not supposed to see the questions ahead of time. You're supposed to be just like you're going to be for your certification exam. You show up, and in 3 hours you're going to see 75 questions, and you got to do them all within 2 minutes each with only your books in front of you, and that's it. That's all you get. And if you can do all 75 questions with me in the same pace, find the codes, pick out the correct answer, and move on to the next question, and you get 90% of them correct, then you know you're ready for your certification exam. So if you want to do that, the workshop is right there on the first page, of course. If you're looking for our Pocket Prep link, it's right there, the pink little pill that's shaking. Just click on that. You can get access to 75 practice questions. with
Cassandra
page
Demurray has become a
numbers
member.
where the answers are. Cassandra, yay! Thank you so much for joining up for the YouTube Club. You guys, that's awesome. And I hope the access to all those old workshops and duck classes, don't forget to check those out. Those got really special, hard to do exam questions that are tricky in 2-hour sessions. So those are great. Look up the duck questions, the ducks underneath the playlist. Just come to medical. When you click on the pocket prep thing, and the very top one is AAPC, 750 practice exam questions. They do go over all 18 areas of the exam, including cases, and they have a pass guarantee, and their prices for access to the 750 exam questions are really cheap. So that's really kind of cool. I love pocket prep. I only recommend AAPC practice exam questions, pocket prep questions, and of course I have an area with bonus questions if you guys want access to it. It's basically the $7.99 one if you want access to all the areas like anatomy, ear, nose, and throat, everything. And that'll get you access to all these pages that include bonus PDFs, which are really kind of cool. So over here to the side are all these PDFs that you can instantly download. This is just my E&M pages. This gets you a ton of E&M stuff that you can download. All these practice exam questions that you can just click on and see what the answer is. To tell you if you got it right or wrong, whatever. But there's a blue million of them. This is just all E&M. So it goes on forever, and I'm always adding new questions down at the bottom. So if you coming back looking for new questions, they're down here at the bottom. But there is a ton of extra bonus PDFs that you can download on a lot of these pages. That's just the E&M page. If you want to go down to the spinal area, I got all kinds of spinal practice exam questions, and it'll have some PDFs too. And then I even started putting like some area pages on here that make things kind of cool to look at. But yeah, there's some spinal stuff, some of my favorite pictures that go along with some of the cases and questions that are kind of cool. So just click on the question, it'll tell you whether you got it right or wrong. So pretty cool. Nothing fancy. It won't grade it and give you an average of how many you got right. So sorry, I'm not that good of a, you got to be like a computer guru to get this coded. So anyway, those are the areas. If you ever want to switch over and do risk adjustment like CRC, I do have a bonus area for it all on one page. And there's like 500 practice exam questions for CRC. And then they have a ton of bonus PDFs that you can download over here to the side for CRC if you're ever wanting to do it. But there is a million questions for CRC here. Just crazy, plus bonus information, just a ton if you ever want to do CRC. Eventually I'll get a page for CPMA, COC, all of them done, but new books are out, so I'm going to be so busy for right now. Don't forget that we've got the blog here that is totally free for you guys, no matter what. You can always come here for free, and I've got tons of practice exam questions written out in all these blogs, just by subject. So if you want to just tackle E&M, if you want to just do spine surgery, if you only want to do the eye procedures, click on these blogs. They're full of information. There's spinal surgeries again, the nerve studies. These are all free for you guys. They all have practice questions with them. Under the resources tab, totally free for you guys. CPT book prep page, there's 8 pictures there. Just click on the pages. It'll tell you how to prep your book so it looks like my book without purchasing anything from me. There's even book prep videos that are not on YouTube. They're right here, so that you guys that don't have a membership on my YouTube channel, if you guys want to see what it looks like to have access to my YouTube membership, this is what happens. You get these videos that'll show you how to do code by code or the anatomy of the CPT book preps. The YouTube membership people all have access to all the other ones that are on YouTube. The FAQs is a great area to go to because the third sentence down has the best list of free resources. So if you are affected by the hurricanes, you could go over here to the AAPC scholarship area. They have a hardship fund for the hurricane victims. So if you lost your computer to rain, if you're in any of those rain areas of any sort, submit to get a new computer, new desk, new books, new whatever could have gotten rain damage. Submit, get you something. And then they also have a scholarship for people that are not affected by the hurricanes, that it's just a regular scholarship, but you have to have been an AAPC member for 1 whole year before you apply for their free scholarship. And then they can get more exam attempts or new books or access to practice exam questions, whatever. They have a scholarship there, so it's pretty cool. Don't forget about the CMS link here that gets you free certifications from CMS. If you just click on that, it'll take you to their MLN page where you can take any of these certification classes completely free from CMS, and then you can add these classes to your resume, which is super helpful. My employer used to send me here every year to do the fraud and abuse training. And if you've already done these two and they're already on your resume, then HR will know that you're a step ahead and they don't have to send you to this website to get this training before you can start touching patients' charts, because everybody's required to do these. So you might as well go on here and do it. It's like a 30-minute course, unlimited exam attempts. It's just a small little exam at the end. You could fail it 32 times, no one would know, and you get the certificate at the end when you do pass it, so don't worry about that. But there's extra other ones, like if you wanted to do the ICD-10 diagnosis coding certification, they have it listed right here. It's an hour-long course, and even if you know ICD-10 coding, it's never harmful to go through somebody else's training and do the practice exam questions at the end. Again, then you're certified from CMS as a certified ICD-10 coder. I mean, it's great. Put it on your resume. Plus, you get the certificate you can print and add. Anyway, it's kind of cool. But there's a lot of certificates, a lot of different stuff. They do switch stuff out. Like they just put this one in June of 2024. They'll take away stuff. They'll put in new classes from time to time. So don't forget to check that out. Super handy dandy in your free time. Not that anybody else has any, but that's under the FAQ area. So there's lots of stuff here. Don't be afraid of my website. Check it out. If you do any orders on my website, that's what this bar is right underneath my little headers. You can click this down drop area, and if you do subscribe to a subscription, like to the practice exam question area, this is where you go to cancel the subscription. If you have orders of instant PDFs downloads and you need the link, or you need to email me about it, just go to my orders. All that kind of stuff is super handy. Don't forget to check out your rewards area, because every dollar you spend, you can spend another dollar and get free stuff. So don't forget to check out my rewards area. So anyway, kind of cool stuff. And you guys know I'm super happy about my Mint Mobile. I just renewed for a whole year. And instead of paying, I thought I was going to have to pay the $300 to pay for unlimited cell phone service for the whole year. That's only one payment of my Verizon, which was monthly anyway. So pretty close to that. But if you do renew and you do buy a year's worth of Mint Mobile for $300, they divide it up into 4 payments, so it's $90 every 3 months. It's great. And that means I have unlimited data, unlimited cell phone. I have the hotspot, all kinds of stuff for the Tesla car, and I'm paying $30 a month There's no other stupid fees, nothing else. It's the best thing ever. I was paying $241 for 2 lines on Verizon. I get better signal than I was on Verizon. Mint's great. I've never been a Teen Mobile. I've never been a Cricket. I've never been any other provider other than Verizon because I knew it was supposedly the best, right? I've been one for decades. And the bills are just too expensive nowadays. So I tried Mint because my oldest son, my IT director, pushed me into it. And he said, you got to do it. You got to do it. So we did switch. Been on it for 2 months now. Love it. So if you guys really want to reduce your cell phone bill service, I promise Mint is good. I mean, I'm in nowhere land, rural Arizona, and I get good service. So can't imagine being in a big city. You'd really get good service. So anyway, it's great. And I got a link there if you guys want to do it. Don't forget to join our free Discord study group. Super helpful. We got practice exam questions also inside our Discord study group based off each CPT. Like if you're doing CCS, you guys have your own practice exam question area with PCS practice questions in my Discord group. If you're taking CPMA, I've got CPMA practice exam questions. We even have a pet room where you can share all your pet pictures, all kinds of stuff. You can go into off topic, and if you have a side hustle, like you sell Mary Kay Cosmetics or whatever else, you can post all that in there. We can support each other, those kinds of stuff can go in an off topic area. But anyway, super cool. Discord study group is completely free. It's also listed underneath the social media tab. It's listed right there. You can click the join now and that'll throw you right into our Discord study group. But I hope this was super helpful. I will see you guys again on Monday, 4:30 Arizona time zone. Right now here in my Arizona time zone, it is 7:16. So I hope this was super helpful. Another free area on my website is the shared gallery. That is all my favorite pictures. So don't forget to check out that area too because that's free. Anyway, I hope this is helpful. Ooh, there's Pocket Prep. There's my Pocket Prep questions. In case you wanted to see what they look like. This is what Pocket Prep looks like. They give you the question. You just click an answer. If that's not it, then you hit the show explanation. And it'll give you the rationale with the page number where the results are at. So you can actually go to that page and it'll show you how to find answers in the book. It's great because that way you learn how to utilize the book. So again, I love Pocket Prep. It's great. I wished I had page numbers on my questions even of where the answers are. I'm not even as good as they are. Anyway, that link again is on my website, so if you guys want to utilize that, that's great. And Mint Mobile, if you do it the first time you show up, the first 3 months are $15 unlimited. I've already used up most of mine, and then when I went to auto renew, the unlimited is $30 a month. I could have gotten the 15. It's just not unlimited. It's like 5 gigabytes or whatever it is. But I don't know if I need unlimited or not. If I'm at home and I don't go on vacation, I don't need it. And I could have done the 15 a month. But I went on and purchased 30 a month just so that in case I go on vacation, I've got unlimited, national, whatever, anywhere. But you can still continue the 15 a month after you get through your 3 months promotion if you wanted to. Anyway, I've got pictures of all that and what the scale is on Facebook. If you go to the Facebook links, there is a post with a full spreadsheet of my actual bill to show you guys what my options were inside Mint, what I could purchase, so that you guys can actually legitimately see how much the prices are once you go through your promo time. So, love it. It's on my Facebook post. Anyway, I hope this is helpful, guys. Anything that could save you $200 a month is great. I think that's fantastic. I'm saving $2,000 a year switching from Verizon over to Mint. It's crazy. Anyway, guys, I'm going to get off here. I'm going to stop rattling. I'm going to go eat my chicken before it gets cold. I hope this is helpful. I'll see you guys on Monday. And then everybody else that I've got, good to know. I'm thinking about trying Mint. You got to, girl. Use my link. It's so awesome. I'm so impressed. It was super easy to switch over to from Verizon. Never even had to log on to Verizon or contact Verizon. They handled it all for me. Anyway, and I hate calling folks. So it was all remote and I did it online. It's great. I love it. I cannot believe how different and better quality. I was at the kids' high school, and they have these high school cell phone blockers over the whole area. And I stand guard and helicopter mom during their dances, and they just had homecoming dance. I was able to, on my Mint phone, turn on my hotspot into my son's Tesla and turn on the screen to play YouTube videos while I was sitting there helicoptering the boys at homecoming dance. So for 3 hours, I streamed through Mint Mobile onto the Tesla car YouTube videos and had not one break in signal. It was great. I've never been able to do anything like that. Verizon could never. They'd have laughed at me. So I thought, great, $15 a month? Oh my gosh, it's great. Anyway, can't say enough about them. And not that I'm a paid promoter for Mint. Not at all. They don't do that. That's how they keep their prices down low. Yeah, it's great. All right, guys. I love you guys. I'm so proud of you guys, and I hope you guys can attend next Sunday's workshop. And go kart. We got to talk about tutoring. I know I wanted to do you today, but it's getting really late. I don't even know if you're put back together after your storm. You got all affected by the storm. I do have one person tomorrow at 11:30. Are you available after that time? So, I don't know. I'm doing her at 11:30 to 12:30, 1. I'd probably be done by 1 my time. So message me. You know my numbers. Message me. Let me know if you want to do tutoring tomorrow. I can't Monday because I got tutoring on top of our live. Tuesday, I only have one tutoring and no live, so maybe I could do it Tuesday. So if not tomorrow, Tuesday. You can do it tomorrow? Okay. Cool beans. I'll message you tomorrow. All right, guys. Love you. I'll see you later. Hope this was helpful.